Hi, my name is Khalid, and I am the founder of Ogow-Emr, a provider of digital health solutions, and we design for two end users, practitioners, and caregivers. So I actually visited Somalia for the first time in 2017 to visit my grandmother, and I accompanied her into her practice when she was getting her eye surgery, and I soon realized that things could have been ran a little bit better, and then I started to innovate. So I actually visited Somalia for the first time in 2017 to meet my grandmother for the first time, and throughout that journey, my first entry point into the country was at a private practice, and I realized that my grandmother did not have a medical record number, and I realized that things could have been done a little bit better. The doctors were working under really tight, constrained environments, so they were doing a very great job. But I just realized that things could have been done a little bit better, so I just wanted to offer some support to them and to my community. It means to know. So for me, it's a constant reminder of why I started innovating, and it was me getting to know my grandmother. But of course, for doctors to know their patients, and for patients to have a better understanding of their child's records. So we've evolved in many ways. The most exciting piece was the human-centered design process, and really understanding your end users, and through the Open IDEO and Gates Foundation Open Innovation Competition. So the biggest challenge that we're faced with is getting our solution into the hands of practitioners. The demand is there. We received over 31 demo requests from private practices all across the country. But we want to be very intentional about rolling out the solution and doing it in an efficient manner. Also reaching frontline workers in the most remote communities across Somalia. Ogow-Emr. Ogow means to know in Somali, and it's a reminder of why I started innovating. And that circles back to my first encounter and visit to Somalia. And a constant reminder of placing that at the heart of our work. But it's also for doctors to know their patients, and for caregivers to know the records of their children.